So hello and welcome back to another week of the Maryland Made podcast. This is Sydney Anderson and I will be your host for today's episode. The Maryland Made podcast provides timely, relevant, and practical information to empower student athletes to explore their potentials and pursue their passions. Today we are joined by two of our amazing Pre-Health Terps, Kamryn Henderson and Mitch Lloyd. For those of you who are not familiar, Pre-Health Terps is one of Maryland Made's student-led groups designed for student athletes who aspire to enter the pre-health profession post-Maryland. So let's jump right into it. Last week, Maryland Made hosted a workshop basically on branding and storytelling. So I want to hear from the two of you. Who are you and why did you join Pre-Health Terps? Mitch, you're a newer member of Pre-Health Terps. So I want to hear from you first. Can you share a little bit about yourself and how you heard about and got involved with Pre-Health Terps?
Yeah, thank you. So my name is Mitch Lloyd. I'm a freshman here at University of Maryland and I'm on the men's lacrosse team. As of right now, I am majoring in kinesiology on a pre-med track. And so I really wanted to get into Pre-Health Terps because one, I'm on the pre-health track. So I wanted to, prepare myself as best as possible for what's to come in the future. And one of my academic advisors actually provided me with information about Pre-Health Terps because when I first came into the school, I wasn't very aware of it. And as soon as he told me about it, I realized that I wanted to get involved and get involved in the community and make these connections with other athletes. And not only that, but just being able to help myself and help others along this track is really awesome. And the first event I actually attended was the Pre-Health Career Meetup, which was 2 weeks ago, and it provided me with constant opportunities to learn more about different careers. There were surgeons, there were physician assistants, physical therapists, and a lot more. So yeah.
That's awesome. And Kamryn, as someone who currently serves on the exec board, can you share a little bit about yourself and your role as the Director of Community and Clinical Opportunities?
Yeah, of course. So I'm Kamryn. I'm a fifth year on the women's track and field team. I'm a shot putter and hammer thrower. I am studying bioengineering with a minor in global engineering leadership. And I am also on the pre-med track as well. So pretty much my role as Director of Community and Clinical Opportunities, I am the co-director along with my other co-director, Maddie. She's on the volleyball team. We really are in charge of, one, we send out a weekly newsletter, or bi-weekly newsletter, which I'm working on today. So hopefully we can get that out by Monday. We also are in charge of looking for volunteering and clinical opportunities, which will be in the newsletter. So make sure you guys actually read it. And yeah, we just want to make sure that we're helping our pre-health student athletes get the volunteering and clinical opportunities that they need to apply to whatever school they want, if that's med school, PA school, PT, whatever.
Cool. And to piggyback off of that, through your lens, what growth have you seen for PHT over your tenure in Maryland?
Yeah, so I've been there since the beginning. I think I was a sophomore when it first started and I was just a member. It's been really great seeing just the number of people grow. So when it first started, it was very small, but now we have a lot more people, which is great, which means there's a lot more student athletes entering the pre-health field or interested in it. And also just allows us to have better conversations. It's also just become, I would say our identity has become more clear. So when it first started, it was very new. So there was a vision of what we could be, but it was how do we get there? And I feel like we're getting really close to that vision. Just our last meetup, 2 weeks ago, that was perfect. We had people, we had physicians, surgeons, PTs, all of that come. And then it was great to have other student athletes come and, interact and get to learn about their potential field. So it's great seeing what PhD can really be. And there's still so much more room for growth. And I'm excited to see what we can do in this year and all the subsequent years.
I agree. And since I've been here, I've only been here for about 6 months now, but I've definitely seen the growth in Pre-Health Terps. And I know that the work you guys are doing is being noticed. For example, I know there's other student athletes who are oh, well, maybe we can start a pre-business terps or just different majors of people coming together and trying to support one another with their majors and with the time demands of being a student athlete. So speaking on time demands, being a student athlete has very intense time demands in general. So Kamryn, how would you say you balance your time between your sport, studying for the MCAT, and having a social life?
Time management, Google Calendar. Like Google Calendar is my best friend. Like I put everything I need to do in my Google Calendar. So I have my classes, I have my practice, my lifts, and then I also put in blocks to study for the MCAT. I block that time off in my day to make sure I don't plan anything during that time. So that's one way that's really helped me balance everything. And I also make sure I leave some time in the day for myself. So that's like watching Netflix or cooking dinner, just something that I enjoy. I really try to block that time off. And I also try not to work on Saturdays. And that's kind of like my social day, go out with my friends, go to DC, eat lunch. Obviously once I'm in season, Saturday is no longer my free day. So I really enjoy it while I can in the fall before spring comes.
That's good. And Mitch, you're offering a little bit of a different perspective, being that you are a freshman. So how would you say you're adjusting to life as a D1 student athlete? And what are some ways you're preparing for the future when it comes to entering the medical field?
Yeah, it's definitely a lot different than high school. You're coming in, I'm waking up at 6 a.m. Multiple days a week for practices. And being someone in the pre-health field, I definitely have more classes than some other players have. So taking any opportunity to get my homework done is really beneficial to me. In between classes, instead of going home and napping, I'll find a quiet place, I'll get some homework done. Giving myself enough time to study, again, instead of going home and being next to my bed where I'm very tempted to lay in it, I go to a quiet place, whether that's using the study hall here at Gossett or going to ESJ and studying in the couches downstairs. Just giving myself any opportunity I can to get ahead is really beneficial. And a big thing that's been important to me my freshman year has been getting sleep. So making sure that I'm going to bed at the right time, waking up at going to bed at the right time, just so I make sure I get enough sleep, so I'm energized and ready for the next day to get my work done. Now down the line, I'm really excited. Again, I think I'm preparing myself pretty well by giving myself a set schedule and giving myself the opportunities to get work done, and making sure I'm not really falling behind. I think that's the biggest thing, just to stay on top of your work while it comes out.
Okay, perfect. And just for to give our listeners some context, what exactly are each of your career goals or aspirations?
So I'll go first. So right now my plan is to get my bachelor's in kinesiology and then go to medical school after, and hope to become something in sports medicine, preferably sports medicine physician.
So for me, I want to finish out my BS in bioengineering and my minor, and also go to med school. And specialty is still up in the air, but like right now, I think I'm leaning heavily towards orthopedics.
Okay. Well, you guys are definitely on the right track. I know at our first general body meeting, we touched a little bit on some of the peaks and valleys of entering the medical field. Although going in the medical field can be exciting, it can also be nerve-wracking. So what are a few things you're looking forward to when it comes to entering the field?
I'm really looking forward to helping others. I think that's a big thing. Being an athlete, I've been helped a lot by various doctors and physical therapists and people like that in my past, and they've provided me the opportunities to get to where I am to play Division I lacrosse. And I'm so grateful of that, and I want to be able to go on and help other athletes like I once was have the same aspirations.
Yeah, I completely agree with Mitch. Definitely like along the lines of really just wanting to go and go and help people. And also like I'm excited to put everything I've learned and like actually use it. Like, I've done all these classes in undergrad and I'm going to go through 4 years of medical school. And like obviously once you're a doctor, you're constantly learning, which I'm also excited about because I really do enjoy learning and knowledge. So getting to constantly be able to keep learning while doing something that I love will be very exciting for me. And I also want to stay in like a competitive field. You know, us being athletes, like we're driven by competition. So being able to stay in an environment that's hopefully still fast paced and competitive, I still get that feeling that I got doing athletics, and I get to move that into my career field.
That's amazing. And on the other hand, what are some of the fears that you have when entering this profession?
My biggest fear is definitely entering med school. I've heard that, it's the workload. You're studying late, you're waking up early. It's a lot of stuff to do. So just mentally preparing myself for that is one of my biggest fears.
Yeah, definitely med school, getting in and doing med school, but also I would say the work-life balance of being a physician can be kind of all over the place, especially when you're first starting out. You're a lowly intern, then you're a resident. So like it takes a long time to get to a place where you can even find that balance. And then once you're there, finding that balance, keeping that balance, and making sure you're still taking care of yourself, because if you're not taking care of yourself, there's only so much you can do for your patients.
Right. I agree. So how would you guys say Maryland Made and other student athlete development programs can support student athletes who want to enter the medical field so they don't feel like the transition is so hard, whether it be to med school, whether it be PA school, or just in general entering the medical field? Like, how can we support you guys?
I would say just continue to provide us with opportunities to learn and meet others. I think one of the biggest things that have helped me is having a community of people like me who understand what it's like to be in the medical field while also being an athlete, because it's very demanding. And they've done a great job already of providing us with opportunities to meet others. And we have the Gossett transition program, which has allowed all student athletes to get some help in transitioning. So yeah.
And Kamryn?
Yeah, so I would say like what you're doing now is great. Like having Pre-Health Terps and being very supportive of that, that's a huge thing that most schools don't have. Like we're one of the first schools that even have a pre-health organization geared towards student athletes. And I think just realizing that student athletes have such a huge potential, and wherever we go, and fostering that is great for any student athlete who enters any field. And also just like continuing, I said something that Maryland Made has done for me that's made me a lot more confident entering the medical field is just kind of like reminding me that I feel like sometimes you can get down on yourself a lot more, but sometimes like you'll go talk to a Maryland Made staff member that just like hype you up for a bit, and you're like, oh, I guess I have like done, like, I guess I am doing pretty well, even though some days you feel like, oh, I don't have enough clinical hours, I don't have enough research, I don't have all this, but you're like, because you're like, but you do have that and you're doing all this. And I think just like that constant support is really helping.
I love that. And I do agree that this is something that a lot of schools aren't doing. And it comes down to the fact of sometimes resources, sometimes people just don't know. So I think the more we can get the message out about the work that Maryland Made is doing, I know that's a big reason why I chose to be a part of this staff, because they are doing a lot of work that's groundbreaking and that I wish I had as a student athlete. So definitely keep doing what you're doing, and we're always here to support you. So we're going to enter a little bit of a rapid fire. So I'm going to ask you guys questions, and you have to say whatever comes to your mind first. So the first one is going to be your biggest inspiration in the medical field.
Probably my mom. She was a nurse at CHOP right out of college, and she dealt with all that pretty well.
That's a really hard one. Like, I don't know. I'm like the first person in like my whole family and or like anyone I know to enter the medical field. Most of my parents are engineering is what my family has always done. So that's really hard. I guess I really like medical TV shows. Like, maybe they're my inspiration. I don't
love that for you. Grace has my heart, so I understand.
Yeah.
Okay, so the next one is biology or anatomy?
Anatomy.
Biology.
Why?
I think
Well,
anatomy is definitely much better with kinesiology.
Makes sense.
I did not have to take like a set anatomy class for my major, but I did have to take a anatomy and physiology and computational modeling class, which was like anatomy, but then like modeling blood flow and oxygen flow in the lung. It was a terrible class. So that's why I chose biology.
Okay. Okay, our next one is, would you prefer to do research or to shadow?
Probably shadow, just a more hands-on experience with other people.
I'm going to say research. I would have said shadowing before, but I just started doing research this past summer and I've really enjoyed it. I feel like it's something I hadn't thought about, which is kind of scary thinking about my career path slightly changing, but I really enjoyed research and I like the innovation behind it. Like you don't get the recognition, but you're sometimes making big changes.
And it's interesting that you guys kind of have two different perspectives because you're in two different places right now, obviously. So it's like, who knows, that could change over the next couple of years, and that's okay because it's like we're constantly evolving, constantly being exposed to different things. So I think that's awesome that you guys both offer this perspective. So before we wrap up, Kamryn, could you share with our listeners how they can get involved with PHT?
Yeah, of course. Well, first one is you can, of course, come to our meetings. They're always posted on the Maryland Made Instagram. They're in the email. So make sure when you're reading your emails and you're checking the Instagram, all information's there. Also, you can feel free to reach out to any of the execs board. Honestly, we're across all the teams. We're on track. We're on women's lacrosse. We're on volleyball. Also, you, of course, can talk to the Maryland Made staff and they can put you in contact with us. But there's many different ways to get involved and you don't have to be in the pre-health field to come to our meetings. It's truly just another avenue for career development. So if you're just interested in learning more about health or just wanting to get with other student athletes or just, continue to develop your career development, I guess, definitely come out.
Perfect. And just so everyone knows, the next general body meeting will actually be taking place this Wednesday, November 16th, and it'll take place via Zoom. So it is posted on our Maryland Made Terps Instagram account. So feel free to RSVP and attend. So thank you all for taking the time to speak with me. I can't wait to see how these resources and connections you gain through Pre-Health Terps push you forward in the future. To those looking to learn more about Pre-Health Terps and all of the other unique student-led groups, follow us on all platforms at MD Made Terps. I'll see you all next time.